أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم بسم الله والحمد لله والصلاة والسلام على رسول الله صلى الله عليه وعلى آله وصحبه وسلم ومن والاه. And the vaccination will be next week again on Saturday 3 to 6. We have a doctor with us, our son, our brother here, Dr. Shafiun, is going to give some advice about medical advice for those brothers who are going to Hajj, inshallah.
Said that the Muslim who is strong is better than the Muslim who is weak. So physically, mentally, health-wise, spiritually, the Muslim who is strong is better than the one who is weak in all those respects. So therefore, with those who have a good health, who have a good body, who have good physical strength, are those who can do more ibadah, who can do ibadah at rest, peace, and who can increase in the dua, afkar, etc. And we want to be in that category, inshallah. So Hajj is just a few weeks away, so most of these points I don't need to go into because you should have done them already, inshallah. So visiting your GP, vaccinations, getting all of your medication ready, making sure that you've got a month's supply of medication. If you're taking your mother or your father, make sure they have a month's worth of medication there. Another good thing, another good idea is for you to have, if you have any chronic illnesses or diabetes, etc., any heart problems, any surgery that you've had, or your family members have had, it's important, it would be a good idea for you to have like a medical report or a medical summary with instructions with regards to what to do when, for example, things don't go so well, or if you become ill. Also, with that, you should have a medication list with all of the dosages. So, for example, if someone was to, we ask Allah subhanahu wa ta'ala to keep us safe, but if someone wants to be admitted to hospital during Hajj, you can give that document to the doctors and they'll know exactly what to do, what medication you need, etc. and etc. Getting the right clothes and personal hygiene, face masks, tissue wipes, antiseptic towels. A vaccination card is also very useful. So all of the vaccinations that you've had to date, if you have that all-in-one card, you can get that from your GP. It would be very useful for any medical practitioners who have to treat you during the Hajj period. Again, basic common sense, personal hygiene, when you're coughing or sneezing, to cover your mouth, because again, Hajj, you get millions of people in a very densely packed area who've come from various parts of the globe with various... So we were talking about hygiene and general cleanliness. So washing your hands. Also, if you have not washed your hands recently, avoid scratching your eyes and your nose and things like that, because these are openings into your body. So again, bacteria and viruses can easily go inside your body through those certain parts of your body. Another thing is all of the males will be shaving their heads, inshallah, after you've completed the Hajj. Avoid street barbers. The reason why, there are certain blood-borne viruses that are spread through blood, that are rampant in the current global population. So hepatitis B, hepatitis C, and also HIV. HIV especially is a dangerous one. So you need to watch out. If you're using a used blade of a HIV carrier, then you will contract HIV. This is a serious matter. So what we recommend is you get your own blade. And you only go to barbers that have these single-use shavers, and you give your blade to them and then use it. Don't trust. No one's going to want to give you HIV, but because they've got hundreds of people queuing up, did they change the blade? Did they, wash their hands? Did they wash? It's very hard to keep track of these things. So you need to take responsibility for your own health. So get your own blade. Of course, don't carry blades with you in your rucksack. When you go to the airport, they'll ask questions. But when you go there, you can buy a disposable blade that you can use, inshallah. Food poisoning, when you go abroad, a lot of people have travel diarrhea. It's something that we're used to having. So you can do a few things to prevent that from happening. Again, when you have food, make sure it's within its expiry date. When you're having fruit and vegetables that you brought from the stores outside, make sure you wash them and cook them properly. Washing your hands, water as well. Make sure you have water from sealed bottles. And don't have iced water, because the ice itself, even though the water, if it's from a sealed bottle, the ice itself, you don't know where it's come from. Avoid street vendors. Camel meat as well. Camel meat especially, and camel milk, make sure it's pasteurized if you're going to have it. Any milk, make sure it's pasteurized. What I mean by that, it's been boiled and then cooled down, and now you drink. also the meat, make sure it's cooked properly. Camel meat has been associated with something called Middle Eastern respiratory syndrome. So you can come back to this country and for weeks and weeks you have this cough and you have this, irritation in your lungs. That's something that you can avoid if you again maintain basic hygiene when it comes to your food. When you're going around Tawaf and Sa'i and Arafat and Mina, you're exposed to the sun. Again, you can be exposed to various heat injuries. So just try your best to seek shade whenever you can, wearing light colors and loose clothing, light colored umbrellas, stay well hydrated. One good way of keeping cool that I was recommended to once before I went on by a fellow medic is that you have those sprays, those perfume sprays, the big ones. If you get rid of all of the perfume and just fill it up with water and just spray yourself whenever you're feeling hot, you cool down straight away because the water is vapor, goes to your face and evaporates straight away and takes the heat away from your face. So you can carry a couple of those with you, and every time you just spray and you cool down. Again, if you have a medical condition, diabetes, heart disease, etc., it's important that you speak to your GP and get some personalized advice from them as to how you should be going about your Hajj. Take your medicines on time, adhere to your doctor's instructions, have a sort of wristband that details your medical condition. So if someone finds you collapsed on the floor, they already know this person is a diabetic, so maybe we need to give them some glucose, we need to give them some fruits so they can have some herbs, etc. Some conditions to be aware of. Again, a lot of people who are coming from South Asia, a lot of them are TB carriers. So after you come back from Hajj, if you're finding that you're coughing all the time, go and see your GP. They can test your sputum and see if there's any signs of TB. Meningitis is a very big one that we should be aware of. Again, you can, because of sometimes poor hygiene in some situations you find yourself in Hajj, meningitis are as a group of bugs and viruses. They get into your spine and the fluid in your spine and also the lining of your brain, and they cause an infection there. The signs of meningitis are a couple very easy signs for us to all memorize. If you have sudden neck stiffness, so it's very painful to move your neck, you can't get your chin to touch your chest, you have a sudden headache at the back of your head, and also when you look into the light, it's very painful. So 3 signs, plus the end stage is a rash that doesn't blanch. So you get glass, you press on your skin and the rash doesn't go away. That's meningitis. So you need urgent medical attention straight away. You need to go to the hospital. There are many medical centers in Medina and Mecca that you can access. If you don't know where to go, the police and the guards, you can speak to them and they will, of course, direct. I've already talked about Middle Eastern respiratory syndrome, typhoid. Again, water, bad water can give you diarrhea, and Legionella, again, air conditioning. Don't sleep just underneath the air conditioning. Legionella is spread through air conditioning systems. So again, be aware of that. If you have diarrhea, don't worry, it's not the end of the world. Carry some loperamide with you. Loperamide, you can get that from the pharmacist. You can have that tablet that will ease things down, and drink loads of fluids, loads and loads of fluids. Septicemia is something to be worried of, especially with our uncles and aunts who are elderly. If they have a bad fever and then they start to deteriorate, you see that their skin becomes red. They get sort of reddening and very warm everywhere. And they start to lose consciousness, or they start to become very confused, then what we need to be worried about is something called septicemia. They have going through septic shock. What that means is they've had an infection and the bacteria could have gone to their blood system and they get very unwell. Again, these are just red flags that we can be aware of, inshallah. Again, if someone's very drowsy, red all over, and high temperature, then seek medical advice. Another virus I thought I just mentioned that there might be some people who come from West or Central Africa to the Hajj. There's a new virus that's been there. Again, if you get a very bad viral infections, massive headache, muscular pains, fever, then take it easy. If it doesn't get worse over the next couple of days, then you can speak to the guards to show you where the most closest doctor is. Sometimes, a lot of the time, the travel agencies that you go with, they do have doctors with them. We'll talk about that. Again, eye dryness, sometimes can be cause a bit of irritation. Just have sunglasses with you. That shouldn't help, and any ointments. Sometimes when you have blisters in your foot, that could really hamper the whole Hajj experience because there's a lot of walking. So if you just carry some antiseptic creams with you, some bandage, and to keep the wound dry, again that will lessen the discomfort. Any cuts and bruises that you get, first thing to do is wash it. So any debris that are in your cuts, you get rid of that and apply a sort of antiseptic agent. It could be Dettol, or it could be any sort of antiseptic cream or ointment or even a wipe, and then keep the wound dry. That's the most important thing. You keep it dry, so a bandage or some sort of plaster or some sort of dressing to keep it dry will stop it from becoming infected, and change the dressings regularly, inshallah. May Allah subhanahu wa ta'ala give you a beneficial Hajj. May Allah subhanahu wa ta'ala accept your Hajj and keep us in your dua, inshallah. And may Allah subhanahu wa ta'ala give you the best of health before, during and after Hajj. Jazakumullah khairan.
Jazakumullah.
Allahu Akbar, Allahu Akbar, La ilaha illallah.
Allahu Akbar. Alhamdulillahi Rabbil Alameen, Ar-Rahmanir Rahim, Maliki Yawmiddin. إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. آمن الرسول بما أنزل إليه من ربه والمؤمنون كل آمن بالله وملائكته وكتبه ورسله لا نفرق بين أحد من رسله وقالوا سمعنا وأطعنا غفرانك ربنا وإليك المصير. لا يكلف الله نفسا إلا وسعها لها ما كسبت وعليها ما اكتسبت ربنا لا تؤاخذنا إن نسينا أو أخطأنا ربنا ولا تحمل علينا إصرا كما حملته على الذين من قبلنا ربنا ولا تحملنا ما لا طاقة لنا به واعف عنا واغفر لنا وارحمنا أنت مولانا فانصرنا على القوم الكافرين. الله أكبر. سمع الله لمن حمده. الله أكبر. الله أكبر. الله أكبر. الله أكبر. الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين
آمين.
ربنا إنك تعلم ما نخفي وما نعلن وما يخفى على الله من شيء في الأرض ولا في السماء الحمد لله الذي وهب لي على الكبر إسماعيل وإسحاق إن ربي لسميع الدعاء رب اجعلني مقيم الصلاة ومن ذريتي ربنا وتقبل دعاء ربنا اغفر لي ولوالدي وللمؤمنين يوم يقوم الحساب الله أكبر سمع الله لمن حمده الله أكبر الله أكبر الله أكبر الله أكبر الله